There is the technical team looked into that, and there will be an announcement sometime soon regarding the restart of public transport in Muscat and within each government and in between. That will be announced very soon from the concerned departments. And of course, as usual, before the end, we'll have to say something for our viewers who are non-Arabic speakers. Unfortunately, the pandemic is still here. Unfortunately, the virus is still spreading very fast in many countries. And you've noted what happened in countries which did very well, European countries that I can use as an example, the United Kingdom, France, Spain, Italy. They did extremely well in managing the first wave of the pandemic. And we've all seen that after the activities started, after people started going back to what is semi-normal life, unfortunately, the number of cases started to increase. Internationally, the number of cases exceeded 27 million, and those who died is approaching 900,000. Locally, we registered yesterday 398 cases, which take our total number to 88,337 cases. Those who passed away yesterday, 11 cases. The total is 762. Admitted yesterday to all our healthcare facilities, 55 patients, which makes the total inpatient today 442, and that's unfortunately more than last week. And those who are admitted to intensive care, 11 patients, the total is 161. Those who recovered, 83,325 cases, and this is a good number, more than 94%. Let me say it very clearly. We will overcome this pandemic together. But what is the price? What's the cost of getting to the other side of this pandemic depends on us all. That's the human cost, financial cost. I can tell you that none of us in the Supreme Committee even thinking of going back to total lockdown or even partial lockdown. But as you've seen in many countries, they resorted to that again. We realized the economic, social, and psychological cost for lockdowns. And we've seen it, we lived it, we don't want to go back to it. But unfortunately, our numbers, which started declining by the mid of July, they started going up again. And the reason for that is very obvious. The lack of adherence to the procedures and things that we can all do. And this is unfortunately by the minorities. The majority of you, and I'm grateful, are doing very well in wearing the mask properly as well. I've mentioned in Arabic that some people think it is a fashion item, covering the ears, covering the mouth. No, it's meant to cover your nose and mouth and to be wear properly. Thank you, Chris. Keeping your social distance. And please also, I need to remind everybody, if you are in the car yourself or with your immediate family, you don't need to wear the mask. If you are exercising wherever you are exercising, you do not need to wear the mask if the distance of a meter plus is there. But I said last week, avoid the 3 C's. Closed places, which are poorly ventilated, crowded places, wherever you are, whether you are indoor or outdoor, if they're crowded places, avoid that. Close contact. I gave an example in Arabic of 5 individuals shared a house, they're friends, in a holiday. Unfortunately, one person took the virus with him, and now 5 of them have the virus. So this virus will not come looking for you. You go looking for the virus, or you take it and spread it to your family, to your friends, to your colleagues. We would hate to go back to lockdown. So help us to go back to semi-normal. Life as normal, I said it several times, is not unfortunately feasible in the near future. But we open restaurants, we open hotels, we open facilities, and the members of the Supreme Committee, we get news that unfortunately certain places are not applying the rules. and as they are open, they can be closed. We are all very optimistic about the vaccine. And there is a word of caution for those who don't believe in vaccines. In Oman, before the Renaissance, 120 children used to die before their first birthday, and 180 from each 1,000 newly born. From each 1,000 births, 180 they don't see their fifth birthday. The mortality rate was very high in our children. Now these numbers are less than 9 per 1,000. And the main reason for that, in addition to other factors, vaccination. What happened with AstraZeneca, which we all admire, the step they took. One person had symptoms which might not be related to the vaccine, but because he is participating in the clinical trial, they halted the trial immediately to investigate and find out whether the disease he acquired is related to the vaccine or not. This is an example of how cautious we are. The scientific community, the regulatory communities, they are very, very careful not to license any product to reach the public before they make sure it is safe, particularly so with vaccines. Vaccines, it's not for 1 or 2 persons. COVID, we are looking to vaccinate billions of people worldwide, so we have to be very careful. I just repeat in English again, please help us to overcome this pandemic. Please keep your physical distance. Wear your mask appropriately where appropriate. Continue the hand hygiene. Continue the respiratory etiquette when you are coughing or sneezing. And if you have symptoms, please stay at home. If your symptoms become severe, kindly contact the nearest health facility and you'll be looked after. We've been asked many questions in Arabic about the testing, and we reduced tests. Yesterday, we did 2,344 tests. The total number since the pandemic, 34,443 tests. So tests are done for those who require them. I wish you all well, and thank you very much.